Hi, I'm Dr. Ron Miller of Pursuit Physiotherapy, and today we're going to go over what should you do if you had a total hip replacement but you're still having a lot of pain. So yes, after you get the total hip replacement, the hip joint itself is more than likely fine. If it's not fine, if there's some sort of mechanical flaw with the actual replacement, your physician's going to catch that. But if you've been cleared that the cement, the bone's healing, the implant or the new hip is actually intact and good, what do you do if you're still having intense pain, whether it's in the hip or pelvis or thigh, etc.? So we've actually seen a lot of these cases lately where these patients would get the total hip replacement, they start some rehab, but they still have intense pain, whether it's myofascial, hip and pelvis. They're having this pain, but they're told that the hip replacement's fine, so no one knows what to do. Now, there is an answer to this. You have to solve the root cause of why you're having your pain, okay? A lot of times, for example, some people, since they've had a arthritic hip, that their pelvis kind of adapts to it. So they're left with this pelvic tilt, but the hip is replaced, but the pelvic tilt is still there. Thus, you can get some SI joint pain with this, maybe some back pain, or some pain in the front of the hip, kind of like a hip impingement. Even though the hip's replaced, your hip flexor can cause some hip impingement symptoms from that. A second thing that also is very common is that they get some groin pain, possibly some thigh pain, or even like a IT band syndrome. A lot of people will be diagnosed with lateral hip bursitis or an IT band diagnosis from that. Okay, and again, it goes into the solving the root cause of this pain. Yes, we know you have that. Now, what's causing it? And again, it goes back into, is your range of motion correct? Do you have sufficient muscle endurance? Is your strength okay? When you're standing and walking, are your biomechanics breaking down, thus causing the diagnosis of a hip pinch, groin pain, or a IT band like symptoms? Okay, so that's number two. The third thing that most everyone misses with this is your leg length. Is there a new leg length now in that hip replacement that is predisposing you to stand awkwardly, having increased pain, whether it's on the hip replacement side or the contralateral side? So a lot of people miss that one. So that could be the third cause of why you're still having your pain. But overall, the point of the video is that there's still hope. If you had a total hip replacement and you're still suffering with a lot of pain, there's still hope. You just have to solve the root cause of it. Is it coming from the back? Is your pain coming from the SI joint? Is it some hip and myofascial pain? Are the mechanics altered now because of the total hip? Thus, in standing and walking, you're getting your pain. So there's a lot of answers that still can be, a lot of questions that can be answered for you. So if you had a total hip replacement and you're still suffering in pain or you're having some new pain, give us a call. We'll get you in for a thorough evaluation and we'll solve the root cause of why you're having your pain. You can reach us at 407-494-8835 or visit our website at pursuittherapy.com. Thank you for your time.